Just so everyone knows, we're going to be starting around 4:03, or sorry, 5:03 in Eastern. Yeah. And everyone, if you have not bought your MedicaZone merch yet, make sure you do buy it, because you are a Zoney and you are a member, so make sure you buy it. Small plug.
Do you sell a lot of stuff?
We've started to, so. Yeah.
I think it's an interesting idea. It's a great idea.
Mm-hmm. Yep. It's cool to have a shirt. It's always cool to have a shirt.
Do I get a shirt for giving a lecture? No.
No. Okay, we're starting in 2 minutes. Okay, we can actually just start.
Yeah.
You have enough people now. Hello everyone. Welcome to today's shadowing session. I haven't done these sessions and hosted these sessions in a while, so it's anyway, thank you so much for joining us today, Dr. Derek. Yep. We are really happy to have you today. So if you like, you can just start by introducing yourself, what you do, and then after that we can go into questions, any questions other people have, and make sure you add them in the comments or the chat section. Make sure you add it there. And we also have a few other questions sent in by members. So.
Okay. Yeah. No, I actually had a little PowerPoint, but I can skip it. It's not that big a deal. You know,
if you'd like, that would be great.
You want me to? Okay.
Yeah,
Let's
sure.
see. Let's see if I can get it to work.
I will make you host.
Cool. Yeah, so for a little bit of background, my name's Derek Papp. I'm a sports medicine doctor. I'm based in South Florida, part of the Miami Orthopedic and Sports Medicine Institute. See if I can get this thing to work. You know, I was asked to talk a little bit about what it's like to be a team physician and be a sports medicine doctor. So let's see if this thing can make it big. So it's being slow. Oh, there we go. So I don't know if you can see my little thing, but anyway, yeah. So I had a little talk prepped on what it is to be a team doctor. I wanted to thank you guys for having me. It's been a weird last couple of years, so it's hard to get motivated to do stuff, and I figured this would be somewhat appropriate after Thanksgiving. So yeah. So anyway, just a little bit of background about myself. I was born in New York City. I moved around a lot as a kid. I wound up finishing I went to part of high school in Mexico City. I came back and finished in Highlands Ranch, Colorado. I went to college in Knox College, which is a relatively small D3 school in Illinois. And then I actually applied to Hopkins as a joke and went there for medical school, and I stayed there for residency, and then have been part-time faculty there since 2011. I wound up moving down here to South Florida in 2017 and have been practicing here in South Florida for almost 4 years now. I'm part of the Miami Orthopedic and Sports Medicine Institute. It's a big corporate thing that's about to rename itself, so that's okay. It's going to be Baptist Health. I think it's going to be Baptist Health Orthopedics, but yeah, we do a whole bunch of sports stuff down here. I don't actually do much of that stuff. I still work with the Orioles, which is, my love. I love baseball. So yeah. So what's sports medicine? I think for your guys' perspective, there are really two roads to it. There's a surgical road and then there's a non-surgical road. I'm an orthopedic surgeon, so I do surgery. As a sports medicine orthopedic surgeon, I do a lot of arthroscopy and tendon repair and ligament repair. But we have another group of people who do primary care sports medicine, and they do all the non-operative stuff. So they take care they do all the cardiac stuff, they do concussions, they do that kind of stuff. These are two of my partners. This is Mike Schwartzen, he works with the Dolphins, and then my friend Sean Curtin works with us with the Orioles. This is actually us in our, we have an academy in the Dominican that we're redoing with COVID, but it's kind of fun. It's very important to think of sports medicine as very much a team sport. It's not just me, it's me working with a whole bunch of people, whether that be, you have to have a great relationship with your athletic trainer, coaches, management, ownership, strength and performance people too. It's a little bit different depending on what levels you're at. This is our one of our daily meetings with spring training, and then this picture to the right's after we actually had clinched the wild card a few years ago. That was when we were good. We're really, really bad now, if anybody follows baseball. But yeah, so basically it is a team sport. There's a lot that goes into taking care of athletes. These are all the different kind of modalities that we use. There are a lot of different toys that we do to, keep people moving. Whether this is cupping here on the left, all the way here on the right, that's dry needling somebody. So it's kind of a neat thing. At the high school level, things are a lot different. It's basically me, an athletic trainer, and then working with parents and coaches to take care of kids. I mean, that's honestly a big part of it. That's most of my practice. Even though I get to do some stuff at the professional level, it's not necessarily what you do in the day-to-day part of my life. It is a lot of fun. Again, this is a couple of years ago when we were good. We have a lot of access to really neat technology. So this is looking at, we're trying to find somebody, we're trying to assess the player for vasculogenic thoracic outlet syndrome. So this is kind of a dynamic 3D MRI that we did at Hopkins, but they don't really do that so much. It's a little bit better to use ultrasound, but yeah, anyway, kind of cool picture. That being said, again, day-to-day stuff's taking care of normal people. This is my friend's daughter, Violet. So this is another friend of mine now. He's a tennis pro well, this was in Virginia. So he's a tennis pro in Virginia, but he had tore his ACL. And so we went and fixed him. But again, a lot of my surgery is arthroscopic. This is doing a debridement of a shoulder. This is actually a AAA pitcher, basically going in and debriding some cartilage defect that he had after throwing. And then this is Tommy John surgery after somebody had tore their Tommy John ligament. This is more I don't know, more common's maybe not the right word, but this is more everyday. This is somebody who has a medial epicondyle fracture. You can see it here, and then you fix it with a simple screw, and then eventually you go in and take the screw out. So just wanted to give a quick little talk. Thanks again for having me. Happy to answer any questions, and we can go from there.
So I can start off with questions first, and then whoever has questions, they can add them in the chat.
Yeah.
So the first question we have for you is, can you describe your career path through the medical field, please?
Sure. So Um, I was, I don't know if it's typical or not, but I went through college. I didn't take any time off after college. I applied straight out of school. I did all the, typical MCAT stuff coming out and took the MCAT, applied, and then I went straight to medical school. I didn't take any time off after that, just 4 years, and then applied to residency, and I was fortunate enough to match. So I kept going. So,
Really cool. Thank you.
sure.
What is the daily life of an ophthalmologist? What?
Uh,
Not
It's probably similar to mine. You wake up, you go to work, you look at people's eyes, and then go from there. I mean, so it's ophthalmology is actually a pretty neat field. They made us do it actually in medical school, so not every medical school makes you do it. But we had to do a short rotation on it. It was kind of neat. But I imagine it's pretty similar to mine. It is a surgical subspecialty. So a lot of people don't necessarily think of it that way, but it's kind of neat. And it's a mix of clinic and stuff, but hopefully that's kind of helpful.
What is the day in the life of your specialty,
So yeah, I guess it's so like tomorrow I'm going to wake up, I'm going to have clinic. So I have clinic, that's my day. So I usually I think it's ideal to have like maybe 2.5 days of clinic and then 2 days of the OR, or maybe 2.5 days in the operating room. So like I'm in clinic tomorrow. I'll operate Tuesday and Wednesday. Thursday I have a whole day clinic, and then Friday I think I'm half day, and then I usually use Friday afternoon as a time to like clean up stuff. So I still see fractures, and then if something is more acute, I'll try to take care of it. So I think I have one case Friday afternoon.
That's really cool. Okay. Is there any specific training I don't know why this person keeps on writing. Anyway, what is your specific training like in your career field?
Okay, so orthopedics is, you go through medical school like everybody else. It's a 5-year residency program, and then it's a series of the internship it's a little different now than I went through it, but it's similar in that you're a general surgery intern for part of that time, and then you do a bunch of small rotations in the field. So you typically do typical trauma stuff, and it depends on where you're at too. You'll do some time learning how to read radiographs. You do some time they actually have dedicated time to teach you surgical skills, which is kind of neat. Like that didn't exist when I was going through it. And then when you're going through the residency, ours was broken up into, we had 5 residents, and so you would do 5 rotations per year. So that would be like, we would do spine, we would do pediatrics, we would do joints is like total joints, so it's like total hips and knees. Sports is one, so that's ultimately what I wound up specializing in. There's foot and ankle, there's hand. So you do these rotations as you go through it. I went to a smaller residency program because I'm built that way. I like it better. I think you get a little bit more attention. I think you learn a little bit more that way. So that's part of the reason why I went where I went.
Mm-hmm. What is one of the toughest case studies that you have prescribed?
So part of the reason I did sports is I wanted to be able to do cases that I enjoy and do stuff that's really hard and not like it. So like if you look at really bad orthopedics cases, I've seen some bad things during training. Like I saw somebody get hit by a train, that was bad. You see a whole lot of really bad fractures, but like stuff that I like to do is I like doing what's like a multi-ligamentous knee. So if you basically dislocate your knee, fixing all the ligaments around the knee, that's a fun case for me, and you can do a lot of it with the scope, so that's fun. I like doing really big rotator cuffs. That's another hard case to do. Again, you can do most of that with a scope. Sometimes you have to open some of it. I have one that's coming up that's going to be really hard. It's a guy who I think he's 49 now. He had tore his rotator cuff about 10 years ago, and now his shoulder is like kind of like a mess. And I think he tore a little bit part of it. He's a police officer, so he needs it. So I mean, if this person was 65, you could treat it a lot easier by putting in, what's called a reverse total shoulder, but he's not. So you have to try to fix it with the tools that you have. So I'll probably use some kind of graft and then kind of sew it to itself. And we'll see what happens. Hopefully. Interesting.
Cool. Yes, interesting. Do you have any advice for high schoolers going to college if they are interested in the medical field?
Yeah, I mean, I think, the best advice I got was you should do what you like. Like, you don't have to, it doesn't have to be science. Like I was a history major in college. I mean, you still have to do all the pre-med stuff, which I did. And then I was fortunate. I mean, for better or for worse, I went to a college where you could do, to get a biochemistry major, it was like 3 or 4 more classes after you finish kind of the pre-med track. So I got a biochem degree also, but you don't have to do all that stuff. So I mean, my biggest advice would be to enjoy your time, go out there. You don't have to, do medicine all the time, enjoy being young.
Okay. And the rest of the questions are all in the chat.
Okay,
So would you like me to read through them, or is it okay?
I can go through. Let's see. Okay. So, anything I don't like about my profession? I think you're going to find that no matter what you do in your life, there are going to be things you don't like. I really like my job, and I like orthopedics. Orthopedics is fun. It's not for everybody. They say that if you want to do surgery, you should love surgery, and you should not want to do anything but surgery. I think that's a little overblown, but you have to be willing to do, have bad hours and that kind of stuff. Doing the subspecialties is kind of nice. It's not as bad as general surgery, but yeah. Are there opportunities for growth in this particular path? I don't know how to answer that. I think there are opportunities to go different directions no matter what you pick. If you're a cardiologist, you're always going to be able to do research in different things. If you are a pulmonologist, you can do the same thing. Ortho, again, you can go any way that you want to go with it. Is plastic surgery closely related to ortho? In some ways, yeah. We both do hand surgery. I had to do a plastic surgery rotation as an intern. So I spent a month in a burn unit and then did a whole bunch of, you had to take face call and then you had to take hand call. So that was kind of interesting. So it's kind of related. The other thing we do is sometimes we overlap where they'll put flaps on really bad injuries that we have to deal with. So they're similar. The paths are different though, to do plastics, there are 2 ways to do it. You either do a whole general surgery residency and then you do a 2-year fellowship, or there are specific plastic surgery residencies that you have to match into. It's a little bit harder. The next question is, do I have my mindset on pursuing orthopedics, or was it something I discovered during medical school? It's what I did. I went into medicine wanting to do ortho. I think somewhere during college, I thought about doing primary care. But I wanted to do ortho. I tried to keep an open mind. I tried to make the most of all my time. I liked OB-GYN. A lot of people hate it, but I actually had a lot of fun. I got to deliver a couple babies because I speak Spanish and nobody on my rotation spoke Spanish. So that was fun. But I would just say, keep your mind open when you go through the whole process. There's no need to have your mind. I mean, if your mind's set on something, that's great, but not everybody's going into medical school feeling that way. And you don't have to. The next question, somebody's asking me if I did any internships during high school. I didn't. What I did is I shadowed a doctor who was my Spanish teacher's older brother. So I would go spend some time with him, usually whenever I had time off. So over Thanksgiving break, I'd spend half a day with him. Sometime around Christmas, I'd spend half a day with him. And then every now and then during the summer, he actually told me, I asked him for a job and he gave me similar advice where he's like, you don't want to do this. He's like, you're going to want to do this for your life. So go do it for your life. He's like, go enjoy yourself this summer, go have fun. And so he's like, to me, that was helpful. And we're still friends now. We still talk. He's in Denver. So I send him patients. If I have patients, I go out there. Next question. Do you spend a good chunk of your day working with patients to develop training plans, diets, and treatment? I don't really help. If somebody asks me questions about diets, I help them. That's not really my thing. There are nutritionists, there are dietitians, so I will refer patients to those people. If somebody asks me, candidly, I'll give them my advice, but it's not necessarily what I do. Training plans, similar, like I'll talk to people about how to work out, but if they're looking for somebody to really train them, I'll usually try to tell them to go see a trainer. I'll give people general advice, but not really. That's not necessarily my job. Were you focused on a different specialty initially before choosing ortho? No, actually, when I was 7 years old, I shattered my left leg, and the ER doctor told me I would never walk again. So my parents ran into a cardiologist that they knew, and he said, why don't you he's like, let's call the orthopedic surgeon. So the orthopedic surgeon came in. I didn't need surgery, but he had to close reduce my whatever. I wish I had the x-ray. I wish I knew what it looked like, but he had to close reduce whatever I had. And then that kind of got me interested in orthopedics. And then the guy that I shadowed in high school, he was the Rockies team doctor at the time. So I liked that. And so that's what I wanted to do. How much time did you take to decide on a specialty? I guess I kind of talked about that. Again, I did keep my mind open as I was going through the different rotations. I probably, if I didn't do orthopedics, I probably would have done another surgical subspecialty because I like the lifestyle. Like I like operating. It's fun. I like being the answer to different problems. I loved ER. Like ER is a lot of fun. That's a great rotation. It would be a great life, but I don't like I don't like not being the answer, if that makes any sense. So like a lot of times patients will be, they come through the ER and they're having some kind of bad cardiac event, and then they need to be admitted to the ICU. And then, your job is basically facilitating that patient going upstairs and getting their stent. I don't want to do that. So that's why I didn't do that kind of stuff. What else did but I did really like it. Like I considered that. What else was kind of like that? I liked primary care. I thought primary care is fun. I think you have a really big impact, and I think it's awesome. The thing that I didn't really like was it's kind of changing, like it's evolving, and it's kind of similar to what I was saying about the ER, where you don't necessarily, it used to be that you'd get to do a lot more procedural stuff, and now you wind up referring it all away just because of the way that medicine is. So I wasn't a big fan of that. That being said, if you're out, if you're in a rural town, you're going to have access. You're going to have the opportunity to do these things, and I think that would be kind of fun. And that would be a fun job. What else did I like? I guess those are probably the big ones. Yeah. All right. I've been thinking about doing a history major for pre-med. Anything I should be aware of? How much did you enjoy it? I loved it, so I thought it was great. It certainly doesn't take anything away from your time. You get to study the stuff that you like. You can pick whatever you like. Like my focus was America in the 1960s, but I got to study Japanese and Korean history, which I thought was awesome, and I got to do a lot of other fun things that I really liked. You just have to make sure you take the classes. So you're going to know the classes you're going to need to take to get it, because I think it's pretty much universal now. It was pretty universal when I went through it, except for some schools would have different. Some maybe they wanted a little more biochemistry, maybe not, I don't know. But as long as you make sure you take the classes you need to take, that's all you need to do. And then you just have to make sure you do well on the MCAT. How many times do we take the MCAT? I'm assuming me, I took it once. I did pretty good, so that was good. Do you love what I do? I do. Do I regret anything or wish I did anything different? No. No, I mean, it's, some people like the idea of taking some time off between, college and medical school. And I had a good number of friends who did that. like they deferred for a year or they waited. I didn't feel any particular need to do that. I think maybe if I traveled, I lived in Mexico in high school, and that was just luck. So that, if I hadn't done that, maybe I would have felt the need to go somewhere else, but I didn't really feel that. How was the first year of internship? Was it mostly scut work? Those are real questions, huh? So I think pretty much no matter, it's not fair. Things are different now. So like the short answer is no. So you do a lot of medicine. It's internships, you're definitely the person who does all the scut on the team. So, for people who may or may not know what that is, scut is all the busy work. So, putting in orders, answering questions from the nursing staff, or answering questions from patients or their family or whatever. So that's all your scut work. The way that surgery works is you're basically, and it didn't matter what rotation you were on, whether it was any of the general surgery rotations or the orthopedic rotations, you show up early. So you would be there at 5 or earlier, and you would go through the labs and write all that stuff down, put it on the list and do all that stuff. But then when you were done rounding, you depended. If I was in ortho, I would be in the operating room. If I was in general surgery, I was in the operating room some of the time, because usually the senior residents wanted to be in the cases more, and it's stuff that I didn't care about. So I don't like being the third hand in there if it's something that's, I would rather take care of the scut when I was in intern, and when I was on those kind of services, but they weren't bad. They were fine. How's the application process for Hopkins? It was, I don't know what, it's not going to be, I'm not going to be fair now. There was a supplemental application when I went through it. I don't know if there is any more. So I don't have anything to do with picking medical students. So there might be one. I think across the country, they started moving away from that. So it wouldn't surprise me if that's the, it wouldn't surprise me if it's the same, it's universal and nobody has to do that. It was the funnest interview I went to. Like, people were super relaxed. People were very friendly. I mean, the applicants and they had a good number of medical students who actually were part of the interview process. And I did that as a fourth year too, where you got to be part of the process and help pick who's coming in. So that was kind of, it was fun. I liked it. I very much wanted to go there, and I did. I was fortunate enough to get the chance. During residency, did I make any mistakes on a patient? I don't really know how to answer that question. The short answer is, of course, we all make mistakes. None of us is perfect. I'd like to think that I can't think of any, knock on wood, I can't think of anything catastrophic. It comes through, I mean, there are going to be times that you do stuff where things aren't necessarily the best. Does that mean that it's a mistake? I don't know. I mean, I can remember a time as a medical student where we had a patient who, she came to the hospital because she had gastric ischemia, which, basically the blood supply to her GI tract hers was severely, severely compromised. But the surgeons wouldn't operate on her, or they wouldn't even try to stent it without stenting her heart, because she had 99% blockage in 2 of her major vessels. So, she basically, as a medical student, you actually get to spend a lot of time with the patients, really more so than your team most of the time. So, this lady, she asked me for, long story short, she's like, well, what would you do in my shoes? And I told her I'd let them stent my heart, and then they can fix your problem, which is, your belly. And she stroked out when she was getting her heart stented, which is, it was horrible. I cried. Is that a mistake? I don't think I would do it again. And if it were me, I would make that choice. It's just that part of what we do is stuff like that happens, and it's unfortunate. But yeah, I've seen some mistakes. I've seen some I've seen some things. But I'd like to think that I didn't do anything that I fixed. I'm interested in plastic surgery, reconstructive. When do you get hands-on work during your career path? It depends on where you're at. I mean, and it depends on where you're going to medical school. They let me do stuff when I was a medical student. When I was going through, I don't know if it's that much different, but like even I remember being on it was the general pediatric service as a third-year medical student. They're letting they would let you close wounds. They'd let you do some stuff that, again, it's not overly complex, but you'll get to do more and more. I mean, ideally, every surgical path is graduated responsibility. So you have to prove that you can do something before you get to do a little bit more. And so you get to do things early. As long as you show that you're doing a good job and that you're interested, I think most of the time you'll have attendings who will like having you there, and then they'll teach you stuff. When or how did you study for the MCAT? What happens if you don't do good on your first attempt? So the good news, if you don't do well the first time, you can take it again. I don't think they care during the process until you've taken it a third time. So I don't, usually it's not uncommon for people to take it twice. I don't remember doing much other than I went to a really small college. We had a group of we had a group of pre-med students that we would study together on the weekends, and then we started doing practice tests together. We did, functionally, we wound up doing the Kaplan course. And yeah, I mean, that was it. I don't remember doing anything crazy. I don't think I would do anything different with that. What I would maybe do different is in medical school, I would spend more time actually studying for step one of the boards while I'm going through classes, because I didn't do that, and I probably should have. My friends who were doing the fields that are super step one heavy, like people who knew they wanted to do radiology and knew they needed to score well, were studying from like day one, which I always thought was crazy, but in retrospect, maybe it wasn't that crazy. What's the most interesting thing you've seen? I don't know. Let's see. What have I seen that's been interesting? Well, from sports stuff, I like when we win games and I got to do some fun stuff with the team. Like that's a lot of fun. Like from a practice perspective, I mean, I remember things like we rotated through shock trauma. So we had somebody who basically had this terrible tibial plateau fracture where there was a small little fragment that kept like closing off their popliteal artery every time you relax their leg. That was interesting and funny, not funny, but kind of funny. And then I just basically held the person's leg for like 2 hours before we took them in the operating room. So it was kind of ridiculous. What else has been fun? I mean, I've seen a lot of crazy spine cases, and again, fractures and that kind of stuff. What's the hardest exam I had to take? So the sports CAQ. So after you finish your board certification, there's a extra exam you can do in orthopedics if you want to do sports. So it's another 6-hour test on just sports stuff. That was the hardest test I had to take. The boards itself weren't hard. Step 1, step 2 weren't bad. I didn't think the MCAT was bad. That test was hard. And then I've been leaning towards both plastic and orthopedic. What's the best choice? I don't know. That's a great question. I guess it depends on what you want to do. So like, if you want to do like, we joke about having, plastics for good and plastics for evil. So, I mean, reconstructive plastics is a really cool field. People really, we need more people to do that kind of stuff because it's hard. Ortho's fun. I mean, there's a little bit of crossover again too. So if you want to do hand, you can go either way. You can do plastics or you can do orthopedics. I think in general, if you want to think about it, I would say that plastics is a little bit more surgically into delicately handling soft tissue versus orthopedics is a lot more smashing bones with hammers and drilling and that kind of stuff. So, and not to say that you do that all the time. I mean, most of the stuff I do is, with the scope. So it's small little holes and I look around the joint, but it's still taking a drill and drilling into the bone to put like anchors into it, that kind of stuff. So they're different. I mean, take advantage of your time. Like when you're in medical school, there's a good chance you'll be able to rotate on both. Okay, yes, reconstructive, but do we always have to have a specific part? No. So if you do reconstructive stuff, that's actually really global. So you're going to wind up doing stuff all over the body. It's not one. You're not going to be dedicated into one particular thing. Hand is it's like its own little thing. So if you did reconstructive plastics, you get to do all the stuff. So it's kind of cool. Cool. Am I done?
Okay. There are no other questions left. Great. Okay. So if there are any final questions, make sure you add them in the chat before we end the meeting here.
Well, thanks for having me. I appreciate it.
Thank you so much for coming. I know everyone gained a lot of information, really good information from you, learned a lot from you. Again, thank you so much for coming, and this was great. This was truly great. Yep.
No problem at all. Yeah. Have a good one. I'll see
You
ya.
too. Thank you so much.
Yeah, no problem. Take care.